Hello friends, I am Dr. Sumeet Jaiswal, plastic and reconstructive surgeon. Today we are going to discuss with you female to male gender reassignment surgery. It is called FTM surgery. It's done in cases who has gender dysphoria. Gender dysphoria is the condition in which the physical condition of his body of the person is not in his alignment with his mind. Means in such cases the body is like female but they think and their psyche is just like male. So we can't change the psyche or mind of the person, but we can change the body of the person. So for this procedure, for this thing to proceed, first thing is needed is that we have to diagnose gender dysphoria. For that we need a consultation with psychiatrist, and they confirm that the person has gender dysphoria, then we can proceed or go ahead for further procedures. The procedures include surgical and non-surgical part. Non-surgical part means hormone therapy, and surgical parts are various type of surgeries. Hormone therapy is very simple thing, in which we do injection of male sex hormone testosterone. Injection are given twice on a month, and it's not very costly thing. A surgical procedure, most commonly requested surgery is top surgery or breast removal surgery, because once breast are removed, the person can move freely in the society with no fear of being judged as a female. So there are two options of breast surgery or top surgery, that is keyhole surgery or double incision surgery. According to the patient's size of the breast and his wishes, we can go ahead with single incision. We can go ahead with double incision, in which there will be two horizontal line and the nipple areola will be formed at new places. This double incision surgery is done in cases where the breast size is more, so we just not need to be removed only the fat and gland, but we also have to remove the skin. So if we remove skin, we have to repair it. If we repair it, there will be some suturing and there will be some line, and that scar will be there. Initially the scar is visible more, but gradually according to the skin quality of the person, it fats up gradually in few months. But if size of breast is small to medium, then we can go ahead with keyhole surgery, in which through very small hole we will remove all the fat and gland, and then pressure garment applied so that the remaining loose skin will get shrink over next few weeks or months, and the edema will subside. Along with breast surgery, very commonly, very frequently, we do TLH and oophorectomy, that is ductal laparoscopic hysterectomy, in which we will remove uterus and ovaries. By removing uterus, there will be no menses after that, no bleeding every month. And by removing ovary, there will be no female hormones, so the feminine features will decrease after that. The feminine features like fat distribution like female will now convert into male type. The muscular development will be there after this surgical hormone therapy, and also body hair will grow, beard hair will grow to some extent after this procedure. So it's a type of hormone therapy. Another question many times people ask, when to start hormone therapy, should we take first hormone or surgery? The more commonly we start hormone first, with the main purpose of this that we want some time to be given to the patient so that he can rethink about the procedure, because surgical procedure is irreversible thing. So by giving some hormone therapy, she will have some idea of what will be her future life, and also it gives some time to her to rethink about the procedure. About surgical procedure, most of the time, as we discussed, that breast and uterus ovary we have done together. After that, the next step can be the vaginal closure. Vaginal closure is the procedure in which we will remove the mucosa of the vagina and then close it externally. After that, or along with it, the procedure done is phalloplasty. In phalloplasty, we will do mostly in 2 to 3 stages. In first step, we will create a phallus or a tube-like skin structure of skin using abdominal skin. This procedure is very simple, and it's take hardly 1 hour, and its hospital stays also 1 day. This phallus creation is the first stage of the phalloplasty procedure. During second stage, we will create urinary tube through this phallus or penis, so that the person can pass urine from the tip of the newly created penis. Simultaneously, we do scrotal creation and scrotal testis implant if patient inquire about that. The third stage, if needed, if patient inquire about that, then we can go ahead with penis implant. Penis implant procedure is the last step in the part of the phalloplasty, because this penis will have not spontaneous erection without using penis implant. Most commonly we use Indian Shah penile implant. So the most complicated part of the whole thing is the phalloplasty procedure. We have discussed it. It's take 1, 2 or 3 stages. Many times patient go just for top surgery only. More commonly they go for top surgery and hysto. The hysterectomy is also called hystosurgery only, and they can live just like life of a male after taking hormone therapy. Hormone therapy, the duration of hormone therapy mostly 2 years or more. It's advisable by scientific literature. It should be given lifelong, but practically it is taken by patient for few years only. So more commonly patient just go without phalloplasty. They can live happily. Many patients who want sexual activity or they want just complete conversion, then they go for phalloplasty procedure. The procedure of top surgery alone depend on what type of procedure, top surgery, keyhole or double incision. The cost in Indian rupees is around 60,000, 65,000, 70,000 range. That is roughly around 900 or 1,000 US dollar. For hysterectomy, uterus removal and ovary removal along with that top surgery, the cost is around 1 lakh or 1,10,000 in range in Indian rupees, roughly around 1,500, 1,400 US dollars. The phalloplasty procedure, the cost of first stage is around 1,000 US dollar, around 75,000. For second US dollar, same cost or little bit more, around 90,000 rupees. And for penis implant, the cost will be around 700 or 800 US dollars. The interval of first and second stage of phalloplasty is around 6 months. Then after the second and third is also 6 months. So this is the short. In short, I've explained about the procedure. There are also some other rare surgeries which may be needed, such as facial surgery. Forehead may need to be corrected, chin correction may be needed, or rhinoplasty or fat grafting rarely requested by the patients. If you have further query, you can WhatsApp us, WhatsApp call us, or send us message. There are a lot of surgical videos you can see in our YouTube channel. Thank you so much.